August is Breastfeeding Awareness Month. Experts say it is one of the most effective ways to support an infant's health and development. There are also significant benefits for mothers as well.
Sharon Curtin-Bottomley is a registered nurse who's also a lactation consultant at Kaiser Permanente Panorama City, and she's here to talk about breastfeeding and the alternatives if it's not possible. Thank you so much for being with us this morning for this conversation.
Thanks for the opportunity.
Okay, so we know that there are health benefits of breastfeeding for mothers and the children. Tell us about those.
Sure,
first.
we hear about that. So we know that breastfeeding actually is, breast milk feeding provides optimum nutrition. That's how we're designed as humans. But as you said, natural does not mean effortless.
Yes.
The benefits, health benefits for babies, we know that breast milk is providing antibodies, sharing the antibodies from that mother to protect that baby. It is inputting protective and beneficial bacteria into that baby's gut. It is turning on their immune system, telling their immune system how to learn to respond to the world. So lots of important things are happening, especially early on.
Well, I think, you talk to so many mothers. I have so many people in my life who they hear all of these benefits. They absolutely are on board with breastfeeding. They want to do it. And then sometimes there are difficulties or sometimes it doesn't happen for people. And I have friends who, through the difficulties, they really start beating themselves up that there's something wrong with them. And sometimes it's just how it is.
We tend to think about it as being natural, just like birth. Would anybody say that birth is effortless?
Absolutely not.
Naturally?
Right,
no,
just
it
because
doesn't.
it's natural.
And breastfeeding is the next step of that. And it really requires effort on both the baby and the mother. And there are many pieces to all of it and to how it is unfolding. And this is why providing early and ongoing is the key, expert lactation care, so that we can navigate through the changes as you grow and your baby grows. That feeding plan needs to grow and change with you, because all of these elements are continuously in a change of state.
So it's my understanding that sometimes there even needs to be a procedure done for the baby to be able to latch on with their tongue. And
sure. So we have concerns with breast milk. Do we have enough breast milk? That's a very common concern. And then do we have a baby who is a good pump, right? Sometimes we have the milk and the baby is having a challenge getting it out for numerous reasons. Were they born early? What type of birth was that? Do they have any sort of anatomic restrictions that may need some time to work itself out? So this is why that ongoing lactation support is so key and vital, because we can look and support all pieces of the puzzle and to move you in the direction that you're hoping to go. This is not a just figure it out on your own thing at all.
I sat with a friend just 2 weeks ago who had our lactation consultant over, had just had a baby, and I was fascinated with the amount of support and how she coaches her through the feeding, and to look at the consistency of the milk and to look at the consistency of what's in the diaper. There's a lot of science that goes into it that can tell you how this is affecting the baby.
Yes, absolutely. So we need skilled eyes to do that. We just can't, as parents, figure it all out.
Absolutely.
Well, that is true at many different stages, I think. And I like that you said that the feeding plan can change. I think a lot of mothers, I think a lot of mothers struggle too of when do I start, maybe mixing with some formula, or when do I start with some food? Do I keep breastfeeding past year 1 or 2? And you work with everybody to kind of figure that out, because that's unique too.
It is so common as lactation consultants. Sometimes people think they're just pushing just exclusive breastfeeding.
Right.
We got to see what are the pieces and how do we make them all work together and optimize. And oftentimes, pumping and formula feeding, and now we have donor human milk that's available to support families while we're getting milk production up and running.
Yeah, it's good to hear all these different options for mothers so that they feel supported.
But we need to have the expert to be able to guide us to those resources and tell us how to safely introduce, and when do we not need that anymore.
Right.
Well, we're grateful to have you.
Move forward.
Yes, it's never all or nothing.
Yeah. Very important job. Sharon, thank you so much for being with us this morning.
Oh, thank you.
Supporting moms.
Thanks for the opportunity.
All right, let's